and I get something where we say you deserve to know, you deserve to be more careful, you deserve to know how to take care of yourself. And waiting we they talk about now something where they affect so many people. If you don't they read so many research papers where they outside there, some people not even take them something where they serious. But if you see people where they affect, you go no say now everybody's supposed to buckle up. It's about asthma. I think sometime a 3rd of May be World Asthma Day, and the whole month. People they have conversation around them, and now why Dr. Nkedilim they here with me on top the show today to create more awareness about asthma. And they know you as Dr. Nkedilim, and of course also known as Dr. Nkedilim, a family physician. And they appreciate them when I see doctors. I don't know, sometimes since last year now, anytime I see doctors, I they feel like say thank you so much for staying back. Yes, and you know why I talk like that. Because so many of when I get the opportunity to run, I mean to japa, because the working condition no they easy for una. So when I see the ones who stay behind, they take out my time to say thank you for doing so. Dr. Nkedilim, welcome.
Thank you so much, Cheche.
All right. So first things first, we want to talk about asthma. For anybody where they listen, Wetin even be asthma?
Asthma. Well, the first picture where they come to person mind about asthma, and I say, if asthma they do person, na that person where they shake one thing, be like say the person down there quarter to die, you want come put her inside in mouth to swallow some gas. But no, that one na emergency event. Wetin asthma be say asthma na disease of the respiratory system.
Okay.
It means say na disease of the lungs. We know say na the lungs na that bag where air they enter when we breathe in, when we breathe out. So na disease of the airway. But the thing about asthma be say na chronic disease. So it means say asthma na long-term disease of the airway. So when you see person they shake something, that one are just emergency event. It's just like hypertension and stroke. Stroke na hypertension na long-term disease. Stroke na emergency of hypertension. So asthma be long-term chronic disease of the lung or of the airway. Simple and short.
For anybody where they listen to me now, or they listen to us on top the show now, how the person go take note so waiting they go through or waiting they get now asthma?
First of all, the person feel no know. Some people feel get these things, but they feel no know. So asthma they common in a category of people. More commonly, they more common for children.
Okay.
Then they spread across adults and then some elderly. So many times some people they diagnose them for childhood. Now the major problem be say even when some of these children get the symptoms, wetin be the symptom? You get 4 major symptoms. Some of them go they wheeze.
Like say they whistle when they breathe.
They call them wheezing. Another said they get shortness of breath or difficulty breathing. Other people they get cough. And another said they get chest tightness. 4 major symptoms then they get. Now if these symptoms come dey worse now they go come get that attack. So some people don't know say anybody where they get attack, it been get some symptoms before the attack come, but that one na a different ball game. So some children go get this thing, or even adult they go hospital. Sometimes where the problem they be say if they no meet experts wey understand the asthma, they fit no get correct diagnosis. So person fit get asthma, my chest just they pain me, they tight. You no get name of the disease. They come on, just they manage. I no fit sweep because if I sweep, the thing go affect my breathing. You no go get diagnosis. But you know say something they worry, and when you do some things, those things are kind of called triggers.
Okay.
So if you no get correct diagnosis, you go miss am. But if a person will get correct diagnosis, the doctor go tell am say, or tell the mama or the papa say, this child gets asthma.
I want to know the correlation between this chest pain and asthma.
Okay. I tell you say the major symptoms now wheezing, shortness of breath, chest tightness and cough. So when their chest tight, it dey be like say them put block. You know block where they tell they build house.
Like say they carry load.
Like they carry load or sandbag put on top their chest. So that tightness now not pain no be pain. Now tightness, the chest go just tight. Then cough, shortness of breath, wheezing. Sometimes they go get just one symptom. Sometimes they go get all the symptoms.
You get any known ways where we say person go feel use to feel like if you get like emergency now, waiting go be the first solution before you begin see a physician.
So generally for house, if these children, whether they get diagnosis or they no get diagnosis, some of the things when people they do wey no correct in the first place, they go give pikin or adult ginger and garlic, think say the thing go. You know go. I thought you say na long-term disease of the airway. So when they can't get attack, sometimes when they get attack, go hospital. Now that time the doctor wait, they see this child when they get the cough. Oh, na asthma. As this child just come now, or as this adult just come for attack. Oh, I don't know. Oh, na asthma. They even cause make this patient they get all these symptoms. So when they come in that attack where people sabi commonly, they go come give them medication to control them. After the emergency, they don't treat the emergency. You know, like hypertension now, they go come give them medicine, make them they take for long time. Now the major problem be say some of these patients they take medicine by mouth, but the best medication where they perfect for all these patients where they live with asthma na inhalational medication. Inhalational.
Okay, make we go on top this break. Once I come back, you go explain that big oyibo where you speak now, and then you go fit sending question. Just sending your question. We dey here for you. It dey worry people. And get age category. If you dey hear Dr. Nkedilim, you go hear who say she talks, say, okay, yeah, it affect children. And if you want really notice more about them, you go know, say, from their younger age, you go begin to see the signs. But you get that big oyibo where you speak when we go. You talk about, we talk about the solution to them. And I really want to make you throw more light inside them.
Okay. Thank you very much, Cheche. So at the talk, say, it gets issues when they on ground. The first one be person when get asthma. Sometimes the problem be say they don't diagnose am properly. Then even when they can't diagnose am properly, the way where they take the medicine. Some people what they do be say that they go they buy the syrup. They go even tell you say the strongest cough syrup on the market because one of the most common symptom among all those symptoms when I talk be cough. Some people go get cough. They go take TB medicine, take everything. Cough no go. Now maybe later for future they go come diagnose. Now asthma you been get. Now you make all the things where you don't they swallow, no they work. Another set of people, even when they can't know say na asthma they get, they go they buy the syrup, they go they buy tablet, they buy syrup, they buy tablet. Meanwhile, I thought say na lung disease. So the best treatment for that kind of disease na inhalation. Now inhalation be something where they swallow. Na swallow be the word now. Then they inhale, they take a in, they take
breathe in,
breathe out. Yeah. So now it be the therapy, now it be the optimal therapy for anybody where they live with asthma, whether na child
so
or na
I want to understand the magic where they inside for them to inhale this steam. Now that be say go clear the airways, huh?
Okay. So now medicine be that thing when they inhale, when they use the proper inhaler.
Okay.
So the medicine go enter the lungs, enter the airway, come begin treat the thing when they.
So they go faster.
They go faster, straight to the point and key, that kind of thing. As opposed to when they take syrup, they take tablet, all that one they enter the whole body.
Before you go enter the bloodstream and
at times they even give some side effects where no necessary. So it is important if na eye now you go put eye drop abi make go straight to the eye. It is important make they take the medicine where they go just deliver straight to the lung.
Wow. And some people get plenty question. Cheche, thank you for mentioning this. And inside Women's Corner, my wife been there pregnant. She be asthmatic patient. Cheche, easy for us. Because every time, it can't be like, say, she want faint. Cheche, we manage that pregnancy until she born. And as I talk to you now, we don't born finish. That one, that my daughter don't do us. Make her for no go lose my wife.
Okay, so the important thing be say, I don't talk and say asthma. Na chronic disease, na long-term disease of the airway. It is important may your wife they take her medicine every day. It get two category of medicine.
Yes.
The one where when person get attack, they go give them that one now for acute emergency.
Okay.
Then you get the one where they call them preventer. So anybody
what's be the work of preventer now?
Preventer, it go help balance the airway. Make that thing where they cause the patient to get attack, it go calm am down. So if they take that preventer morning and night, morning and night every single day. Even when at times they go dey exposed to maybe their trigger, whether na dust or na rain or na flower, the thing no go trigger exactly. So e go just calm the whole airway down
because it already clear everywhere before.
Exactly.
Now I want to talk about the awareness in especially in Nigeria. How aware the people dey about asthma?
The thing for this year's asthma day na closing the gap.
Okay.
The major set of people, apart from some healthcare practitioners wey no fit get the skill, no be all of them get the skill to
no be
diagnose.
everybody get am.
Another set of people where they suffer for this knowledge gap na the patient.
Okay.
For example, now this particular person wey talk say im wife dey suffer the thing. If on a normal day she dey take her medicine every single day for that pregnancy, she go carry that pregnancy, no shaking, nothing go happen. She go born, nothing go happen. But e mean say that one for every day she no dey take am. Do you understand? So she come begin get complication, breathing difficulty and all of that, because people fit get asthma and they fit live their full life. You know David Beckham? You sabi am? That footballer.
When they play with ex-footballer, he be asthmatic person.
He be asthmatic
now
patient.
Now he go play ball.
Oh, wetin happen? He dey take him medicine every day.
The preventer.
Do you understand? Na him make Oyibo pass us, but we are getting there.
Good afternoon, Cheche. I'm one of the patients that suffer from asthma right from 2014 till now. I'm using the inhaler. And also, please, any other solution to stop this? I believe that the second one where you mentioned the
you need preventer medication every day. You can live a full life.
Cheche, good afternoon. Asthma na bad illness. My colleague get and if you trigger that inhaler, must they close to ram. Are they clear my chest? You they use drink to clear your chest. Okay, you they use drink to clear your chest. Doctor, you here. Cheche, how be the best way for me to stop today? You please ask Dr. Nkedilim. How be the best way to stop today using inhaler? I don't tire.
Okay.
Somebody said she don't tire.
Like I talk anybody when get asthma suppose they on preventer, long-term treatment. So if you use preventer for morning before you come out, you take your preventer, go do your work, go do your business for outside. When you come back for night, before you sleep, you take your preventer.
And I'm so asthmatic. Thank you for bringing doctor. I really suffered when I was in secondary school because we no find out on time. I suffer regularly, coughing, difficulty in breathing, chest pain, everything she mentioned. And then I won't have strength to walk, but now at least I'm managing it and I'm fine. Though sometimes I still have the attack, but I know what the problem is now.
Now the problem with that one be say, people no supposed to even get attack. So if they take your preventer medication, you no go get, because people when they die in attack now.
Trigger the attack.
So different people get different triggers. Some people na dust, some people na this mold, some people na cockroach, some people na rain, some people na season. But as long as they take their preventer medication, it go calm the airway, so that person no go get attack. Because sometimes they go get attack, begin use the medication for attack, it no go work. Others people when they die for asthma, when they hear for news, when they get sensational death, now that attack cause am. They get attack. Sometimes they no get their reliever medicine, or they get the reliever medicine for hand, but you know can't they work? Why? Because everywhere the airway no they calm.
So how they go take calm down that
by taking
that
their preventer medication every single day. Say you understand? So doctor, people like David Beckham them now, if then they get attacked, they don't go they. Say you understand?
You not go react that much.
They don't go they play that ball.
Please, doctor, incessant sneezing, now one of the symptoms.
No, sneezing not follow, but many times for asthma get allergy as a underlying as part of the component. Allergy. Sometimes person when get asthma, you go find out say if they get skin itching, eye itching, excess catarrh, all na part of the whole syndrome of allergy. So some people go get asthma, get eye scratching, brown eyes, they go scratch eye go change color. Some people go get asthma, get constant catarrh. You see some people morning, afternoon, even inside Sahara desert, they get catarrh. Not be that one, na the asthma they cause. All right, that condition.
We go take this break. Once I come back, doctor, we'll go to wrap up, but then we'll go answer more questions and then we'll go to wrap up. Now still asthma, we'll talk about on Top Women's Corner. On any medication at all.
Yes, thank you very much. So before we even head on to that, to get person where they talk say she want stop to the use an inhaler.
Yes,
so waiting I want even let them know be say if you they use your preventer medication now long term, no be something where you go just begin stop anyhow. No, now long term, just like hypertension, you know go just stop hypertension now long term. So you go they use them long term. I talk say they get two categories of medication. You get the medicine when they use for emergency. If you be asthmatic, you don go emergency before, you get one inhaler wey dem go give you. Most likely that inhaler na the reliever inhaler wey dem dey use for asthmatic attack. Reliever na to relieve something now, relieve. Then the one wey dem go give you for long time, even when you no get attack, or sometimes you just get symptom, dem go give you that medicine for long time. You go take am one for morning, one for night, or 2 for morning, 2 for night. That one na preventer or controller. If you go see your doctor go tell you. If you carry your prescription go meet your pharmacist, they go tell you. You know what?
Okay, so you don't hear what she talk now. Go meet a doctor, go meet a pharmacist, or anybody. Just tell them, say, this Dr. Delim that shout, preventer. Or maybe before Dr. Delim go, I believe so you there Instagram, so maybe they need to DM you. Cheche, she is right. I have been asthmatic from birth, and the prevention drug helped me so much. I have 2 boys now without labor stress or allergies. Thank you, Oga Madam, for being very thoughtful of us. Asthma don't become a problem. I remember when my sister been there for labor, you know, her asthma attack start. But God bless that doctor that day. That the doctor knew wetin he do to clear her up. If not, I start for lose my sister. God no go let. Good afternoon. I sneeze frequently. No mixed sneezing with this one. Doctor, you don't carry the one way. You know what treats that bring come for you. Good afternoon, Church. Please, I want to know what about the asthma patient. She was not born with it. She was living close to air polluted area, and there was industry releasing chemicals in the air. Later we relocated, and I started having breathing problem, and they diagnosed me and they say it was cancer. I'm sorry. It said it was asthma. Yes, please. Not for you. Now wow, Vincent from Abraham Adesoyo.
Okay, you get what they call occupational asthma.
Okay.
So some people now just for their place of work, that thing they happen. Immediately they change location, the thing go calm down. Some other people, they get the gene for asthma, because asthma too, the regular asthma, they for family, then they inherit am. Some people go skip them, go their pikin, but then they inherit them. So person wey get the gene, we can't get occupational asthma, they need treatment, or they need to leave that work, or prevent exposure to that thing where they cause trigger for the place of work.
Okay, doctor, is it not true say person must do surgery before to stop asthma?
You see, say that one na myth. May we bust that myth. Asthma na disease of the airway. If you take your preventer medication, it should clear your asthma. Except maybe asthma is
airways go clear.
Airway go clear every day, morning. Now 2 times that they take a morning and night. Now him be the preventer. I know they talk of the aborter.
Dr. Dilam, please, we need to know the preventer. Okay. Hi, Cheche. They say meet your physician to ask. Please, there's any connection between asthma and pneumonia from St. Thomas?
Okay, so asthma, I don't talk say you get gene that they inherit them, they related to allergy. Pneumonia na virus fit cause am, or bacteria fit cause am, or fungus fit cause am. You know they related to allergy like that. No. It's only sometimes when foreign body can't enter the person's chest where the doctor go find out. All
right. And Cheche, please let me ask doctor, can she mention the name? She know if you mention name of the preventer.
No, it's unethical.
Hey, darling. No be so that they do. If the preventer sell am one, make it call here, we sell am 15 minutes for him. Please, I just joined this topic. Yes, darling, we talk about asthma. Okay. Good afternoon. My immediate elder brother is asthmatic and smokes weed. He said he used to help him to condition. Dr. Dilim, please, the correlation between weed and asthma.
No, the person thought say they drink some kai to clear in chest.
Yes.
That one safe, no be medicine for asthma.
Meat plenty for here.
Meat plenty. And the worst part be saying that the patient they suffer am. And if their chest no clear, they are at risk of untimely death.
How you they smoke and then you they asthmatic?
In fact, some of them just they
you get such patients.
Not in Nigeria. In fact, some of them this week when they smoke, now the suffered of Nigeria just push them.
What be the worst way you don't see for your patients?
The person get attack.
Yes.
Inhaler for reliever.
Yes.
For acute attack, abi.
Yes.
The thing finish.
Yes.
He get like sis. The man know they take controller. The guy can't drive. He break traffic. Come reach hospital gate. By the time we rush out, the man don't die. We see all the empty canisters of the reliever
We don dey
medication
take.
you see all the just scatter for the dashboard. He drive himself reach hospital.
He drive
pass
himself.
for the gate. Pass out for the gate.
Oh,
by the time
dear.
he reach there,
Running for
nothing,
his life.
Nothing. Trying to come and get emergency treatment for emergency. Na so the man pass.
So wetin be your best advice for anybody wey dey asthmatic?
Anybody wey dey asthmatic, avoid your trigger, take your preventer medication, see your
so
doctor.
so that preventer dey important.
E
first.
dey important, very very important. All those people wey say the person asthma kill am, e no go dey happen like that. So that death from asthma dey preventable. In fact, e get one woman when I see, she say pikin get asthma, e mean say she go die early. And that one say pikin get asthma, e mean say she no go marry husband. If they hear say she get asthma, she no go. I say no. When you take your preventer, everybody go dey happy, lungs go dey happy.
Yes, so Cheche, I get it now. Okay, doctor. Oh my goodness. God bless you for coming on Top Women's Corner. Cheche, I dey pregnant. I'm asthmatic, but I been dey take my preventer. God bless. The doctor also helped me ask doctor, this preventer, is that medication that you take to prevent attack, right? This person reach your mouth. Say yes or no.
She wan put word for my mouth.
Say yes or no.
If you take am, attack no go come.
Okay,
no
so doctor has answered you.
She did there.
Dr. Dylan, thank you so much.
Thank you, everyone.
Thank you for your time. And
Thank
yes, this problem not be me go carry am. When they go take reach out to you, you dey social media
I
platform.
dey social media. I dey
Okay.
Instagram. Dr.
Alright.
Delim.
Spell am o.
D-O. Doctor na.
Uh-huh.
D-I-L-E-E-M.
Okay, D-I-L-E-E.
L-E-E-M. Yes.
Okay, the doctor is not D-R, but
No.
complete doctor.
Complete Dr. Delim.
Oh yeah, make una invade there. You go hear question, you go tire.
I know na,
Dr.
they wait
Dylan,
there.
answer my people. Answer them. Thank you so much for Women's Corner, Cheche. I love you too. And of course, Dr. Dylan, they say thank you for
I
coming.
love you too.
Now that much we'll go fit take on Top Women's Corner for asthma, and I get my friends and sponsors who I want to talk to now. Hopefully you don't understand what they talk about. We want to make you day alive, stay safe, and of course they're very healthy. Okay, do the needful. And I know say all your physicians they go collect them today. Go call them for phone, please. Oh, I don't hear what will be preventer, doctor. Dr. Dylan, thank you.
Thank you so much.
You never download the Wazobia FM app? Hi! You dey miss wella. Oh yeah, download our Wazobia FM app today on top Apple Store and Google Play Store. Make you fit listen anywhere and everywhere. Join the Chukmat family today.
Wazobia FM 95.1.
Chook mouth.